Pillai, IT Lead, North Lincolnshire CCG. In this video, we will learn how to use the referral tree from Primary Care IT to do referral forms within EMIS. The first thing I would say you have to do is get the referral tree loaded onto your protocol launcher. Get the patient who you want to fill a referral form for. Click on referral tree. That will bring you down to a few options. So in this example, we are going to refer this patient to the respiratory physicians on a 2-week wait. I'm going to click 2-week wait. I'm going to find lung and pleura. It is then going to ask me whether I want to launch the referral form now or do it when I finish the consultation. I will do it now as I've finished my data entry for this patient. It is now going to ask me which hospital I would like to refer the patient to, United Lincoln Hospitals or North Lincolnshire and Goole, which is what I will choose. Now, the thing I like about this is it's actually opening the document and doing the mail merge within EMIS rather than moving externally to another third-party software. Put my name there. And this is the great bit. This is the part of data control where it is now asking me what information do I want to send in that referring document. So the first one's on investigations, and I get to choose which investigations I feel is appropriate. That is then followed by the medication list. Now, previously what used to happen in DXS is it would auto-populate all the medicines, and unless you were actually actively going through it to delete it, the receiving doctors would have a list of all medicines, whether it's appropriate or not. And this is once again a good opportunity to do a bit of data control. By clicking the top box over there, it unticks all the boxes, and then I can choose to tick the ones which I feel is relevant for this referral. This is great, the next step, because it's asking me which consultations I would like to include in my referral document. So for example, I've seen this patient a few times and I'm going to include 2 consultations, and that avoids unnecessary duplication when I fill up the form. It's going to ask me which problem titles I want to include, and once again this is coming back to the theme of data control. So I think things like ischemic heart disease, heart failure, atrial fibrillation, things like that's probably important. Now, it does appear a bit more clicky before you get to the document, but the great thing about this is you've done the majority of the data control already. So now you're into the referral document and you just have to finish off the final bits that you would normally do anyhow. Yeah. And when you've finished the document, scroll down, you will see the bits of data that's been pulled through, the consultations that have been pulled through within that referral form to avoid unnecessary duplication, medications, the allergies. Finish the document. At this stage, you would press save and close. And this is the next step of doing referral forms. It's about safety. Have we informed our secretaries? Well, you've got a display task there asking you to send a task to the secretaries, which I can choose to do now because it automatically brings up the task box. Now I can choose to ignore it if I want to, or send a task to my secretary saying a 2-week form has been made for this patient. And now the final box is telling us, please copy and paste the following information into AccuRx and send it off to the patient. So that way you've got triangulation, you've got the document saved in the patient's record, you've got a task sent to the secretaries automatically, and finally you've also got a text message being sent to the patient.